Well, there is mixed reaction this morning to Victoria's roadmap to ease the state out of those coronavirus lockdowns. Medical groups have welcomed the plan, while business is describing it as a road to nowhere. The Premier, Daniel Andrews, yesterday announced plans to extend Melbourne's strict stage 4 lockdown by another 2 weeks.
He also outlined timelines showing many businesses won't be able to open their doors to the public until at least late October. The federal government says the news will be hard and crushing for Victorians. Steph Ferrier is in Melbourne for us this morning, and Chris Tester is in the regional city of Mildura. Good morning to both of you. Steph, I want to start with you. First of all, I guess, is the longer lockdown for Victorians?
Yes, hi Lisa. It's definitely a long and rocky road to recovery for Melburnians here, with a mixed response to this plan. Plaudits from nurses and the Australian Medical Association, but a real lashing from the Chamber of Commerce, which describes this roadmap as a road to nowhere. Now here we're going to face an additional 2 weeks of stage 4 lockdowns with just a few tweaks. There'll now be social bubbles for singles. That curfew won't start until 9 o'clock at night. There'll be playgrounds opened, and thankfully we'll now have 2 hours of exercise a day or outdoor recreation to be able to enjoy. But any further move after that is going to really be driven by the numbers, and there'll still be strict limits. There might be childcare reopening, but there'll still be more pain for kids and parents. The youngest and oldest students won't go back until the second week of term 4, and then for years 3 to 10, well, they'll have to wait until the end of October, and even then it's not clear if they'll even get back this year. There's some real pain for businesses as well that we've heard. The retailers are saying that this is devastating, that they won't be able to open for several weeks until late October as well, and many businesses will simply go to the wall. Premier Daniel Andrews does say that he is going to be giving more information in the coming days about support for businesses, but he says that getting out of these restrictions too fast would only see us marching headlong into a third wave and another lockdown.
I know that businesses large and small are experiencing very real pain at the moment, and if I could have provided a different timetable, given them what they were asking for, then I would have done that. But to do that now, to open too much too soon and not take safe, steady steps, they won't be open for long. They'll be open for a few weeks and then we'll be back into lockdown. That's not good for anybody, anyone.
And Chris, you're there in Mildura. How do you reckon this is all going to go down for regional areas?
There's a great deal of frustration here in Mildura. There'll be a slight easing of restrictions on the 13th of September, but beyond that, Victoria has set a target of needing fewer than 5 new cases averaged over 14 days across all of regional Victoria for a further easing of restrictions. In parts of the northwest where I'm standing at the moment, we would already meet that criteria at the moment. So there have been, straight after Daniel Andrews made his announcement yesterday, there were media releases issued by both state and federal local members of parliament, and there was great frustration from business owners. They were really hoping for a bit more to be announced straight away. They were hoping that certain parts of the state that don't have any coronavirus cases at the moment, and in some cases have never had a case, would be treated differently. The Premier Daniel Andrews did address this yesterday in his media conference, stating that given where regional Victoria is at compared to Metro Melbourne, it's conceivable that it could be 2 steps ahead of Melbourne within a matter of weeks. He didn't feel the need to put in confusing rules across different parts of regional Victoria, and he's flagged the possibility of treating the Geelong corridor, which includes Colac, separately to ensure that the one small region in a couple of weeks doesn't hold back all of regional Victoria from a further easing of restrictions.
Yeah, there'll be much more on this, no doubt. Chris and Steph, thank you. And for more information on Victoria's restrictions, you can call the Victorian Coronavirus Hotline on 1800 675 398 or visit the Department of Health and Human Services. The website is on the screen there. The federal government has signed a $1.7 billion deal with pharmaceutical companies to secure enough COVID-19 vaccinations for all Australians. Vulnerable people and frontline healthcare workers will be first in line for the vaccine. If the trials by the University of Oxford and University of Queensland are successful, the majority of the doses will be made locally. The rollout would take place throughout next year and excess vaccines will be donated or sold to other countries. OK, we're going to go north of the border for the latest on the coronavirus situation in Queensland and New South Wales. Michael Rennie is outside Ipswich Hospital and Alexia Atwood is in Sydney. Michael, I want to start with you because we've been reporting this news that more than 200 hospital staff are in quarantine this morning.
Yeah, morning, Lisa. They certainly are here at the Ipswich Hospital. And behind me, there was actually a line of people here earlier lining up to get inside for treatment this morning. So the hospital is still running, but I think it's around about 222 staff members from this hospital have gone into quarantine after one nurse tested positive to the coronavirus. And that nurse had been working directly with infected patients for some time. And so that's seen the hospital go into, well, it's still functioning and the emergency department is still functioning, but obviously nowhere near to the level that it normally can. So a lot of the elective surgeries and other things that can be moved elsewhere have been either postponed or relocated. So that was one of two new cases here yesterday. The other was linked to the Staines Memorial College. That was a sister of one of the infected patients, of one of the infected students, from that school. But was already in quarantine anyway. So that was 3 new cases over the weekend, 25 active cases in the state at the moment.
All right. And Alexia, you're there in Sydney. What's the situation for the state of New South Wales?
Well, Lisa, New South Wales has reported 10 new cases. 4 are luckily in hotel quarantine returned travellers. 4 are linked to known sources, and then we've still got 2 mystery cases in the last reporting period. So of those known cases, there's 2 Year 7 students at King Koppel Rose Bay in Sydney's east. That's where I am now. So today the school is closed, it's going through a deep clean, and the whole school community is helping authorities with contact tracing. Now these 2 Year 7 students, that they are linked to this CBD cluster that keeps growing and growing, and it started at the Tattersalls Club in the CBD. So it's now up to 64 cases, which is of course causing authorities some serious concern, and that's the reason that they said this Father's Day, please no one go into aged care facilities, the risk is just too high. Now, staying in the city, the authorities have issued a health alert for a medical centre, Hyde Park Medical Centre in Liverpool Street in Sydney. A case has attended there and authorities are still assessing the exposure risk. Now, going back to those 10 cases, there were 2 mystery cases, and one of those is a student at Lidcombe Public School in Sydney's west. That school is also closed for cleaning today and contact tracing is underway.
All right, Alexia and Michael, thank you.